Hello, everyone. My name is Jane DeMoby. I'm an attorney here at Tennessee Justice Center, and we're coming to you today with some updates on the proposed Medicaid and SNAP cuts. Now, if you've joined us before, you know that we host these meetings regularly to bring advocates together and give them up-to-date information on where the cuts stand, what the threats are at Congress, and most importantly, what you can do about it. Next slide, please. Just a few logistics and housekeeping. This webinar will be recorded, and the recording will be sent out to all participants who registered shortly after the meeting. At least half of this briefing will be for Q&A, so this is really an opportunity for you all to learn more about the information here, but also ask questions, get clarifying information, and really just leave with a better understanding of what's happening on the political level. We would love it if you can introduce yourself by putting your name, organization, and county in the chat. It helps us to know where you all are coming from here in Tennessee, and really build the community that we've formed so far. So really excited to have you all here today, and we'll go ahead and get into it. Next slide, please. Today, you'll be hearing from me. I'll be moderating the call today, but most of the information will come from two major experts in the advocacy space here in Tennessee. You'll be hearing from Signe Anderson, who is TJC's Senior Director of Nutrition Advocacy. More on that later. And from Gordon Bonnyman, who is a staff attorney here at TJC, but also the co-founder of our organization. We'll be bouncing back and forth with some of the up-to-date information, the political updates, a little bit about the stories of who Medicaid affects, who SNAP affects, and then of course they will be answering some of your questions in the Q&A portion a little bit later. Next slide, please. And yeah, just to get everyone clear on our agenda, we'll start off with some introductions, and then we'll have Gordon present the Medicaid portion of today's call. We'll have Signe present the SNAP portion of today's call. And finally, like I said earlier, go over your questions, provide some answers and some clarity. And then of course, close out with some action items and some information that you all should have leaving this call. We're going to do something a little bit different today compared to our other calls, which is to share some real stories we have from people who are potentially affected by these cuts. So keep an eye out for real stories from real people, which we hope will help contextualize some of the conversation today. Next slide. Without further ado, I'll be turning it over to Gordon. Just really quickly, Gordon is, like I said, a staff attorney and co-founder here at TJC. He has extensive experience litigating on Medicaid issues, as well as understanding the legislative process that affects Medicaid, both on the state and federal level. Gordon can tell us everything we need to know about the proposed cuts to Medicaid, and he is a wealth of knowledge, so he'll provide some key insights. Handing it over to you, Gordon. Thanks.
Thank you, Jane. I don't think I can tell you everything we need to know because a lot is still inside of a black box, but we'll get right to it. Next slide, please. Just a quick recap for those who haven't been on our earlier webinars or briefings, or who have not been following it really closely in the media. Congress is using a special process called a budget reconciliation, which allows them to fast track legislation and to limit amendments and to block filibuster in the Senate. So in contrast to the usual convoluted and often time-consuming process that we're used to with Congress, the process they're using now really greases the skids, and it puts a lot of momentum behind the legislation. Congress has already adopted a budget resolution, which is the first step in this process, which tells the committees that have jurisdiction over various programs or expenditures of federal money, gives them instructions about either spending or saving certain items or amounts from the body of federal law. And in this case, the budget resolution that was adopted a month ago instructed congressional committees in the House and the Senate to cut more than $1 trillion from the safety net. And the committees in both houses have been working on that. That, as you see here on the slide, that the instructions included $880 billion from Medicaid and $230 billion from SNAP. The committees have been drafting the amendments even during the Easter recess, and they were to issue the amendments this week, but as I'll explain in a moment, that was delayed. The mechanics of this process are that the House goes first, they adopt the amendments, and then they send those to the Senate. Next slide, please. As I indicated, the timetable is affected by the budget resolution process, budget reconciliation process, rather, excuse me, and that the goal from the beginning of this session of Congress, and in fact, from the moment that President Trump was elected, was to pass what now President Trump is referring to as one big beautiful bill by Memorial Day. And that would mean by Friday the 23rd, which is just a little bit over 2 weeks. They have been holding to that schedule, going through the various steps up until this week. And the committees were supposed to, in the House, were supposed to issue their amendments. So again, the process is the committees are told, you've got to achieve this amount of savings. So come back to us, the Congress, with amendments that will contain the cuts that will produce that amount of savings. This is all tied up in the extension of the Trump first term tax cuts of 2017. They want to extend and expand those. And so the process that we're in now that affects these safety net programs is using savings from those cutting those programs to pay for the tax cuts, which incidentally disproportionately affect the super wealthy. That was to have occurred, the release of the amendments were to have occurred this week by May 6th, but that got delayed a week until May 13th, which is good news. It shows that the pressure from the public of don't make these cuts has made it difficult for them to come to agreement. Next slide, please. What we won't know until the amendments are released is which people will lose Medicaid or SNAP, which benefits will lose Medicaid or will no longer be there. I mean, for example, will they not cover as many prescription drugs in the case of Medicaid, or will they reduce the amount of food assistance in SNAP? We don't know those details. In the case of Medicaid, we don't know how much they will cut the rates that Medicaid pays to hospitals, doctors, and others. And it could well be that in the case of Medicaid, at least, which is over which states have more design authority, they may just cut the amount of federal money and then hand the hot potato to the state to say, okay, you're getting less money for this program, and you people figure out who's going to get cut or what's going to get cut, and pass the onus of that politically unpopular work off to the state. Next slide. We've heard a lot of contradictory GOP talking points. President Trump has pledged that Congress won't touch Medicaid, which he loves and cherishes. These are his quotes in an interview with Sean Hannity. On the other hand, he has endorsed the budget resolution, which would cut $880 billion in Medicaid and $230 billion from SNAP. So he endorsed that, even though he said the Congress wouldn't touch Medicaid. Some factions within the GOP are saying that $880 billion in cuts are not enough, and they demand deeper cuts. They also demand deeper cuts in SNAP, or they won't vote for it. But the most recent polls from a week ago show that 76% of voters want Congress to protect Medicaid. And many representatives and senators are now saying that the budget cuts won't affect individuals, that the savings will only come from reducing fraud and abuse or requiring adults to work in order to qualify. Sadly, those claims are not true. Just today, the Nonpartisan Congressional Budget Office issued a letter. Next slide, please. That confirms that there's no way to cut billions of dollars from these programs without cutting people's health care and nutrition. Cutting hundreds of billions from Medicaid does nothing to address waste, fraud, and abuse. Instead, it takes health care away from millions of children, seniors in nursing homes, and people with disabilities. Work requirements, which are generally popular with the public, but that become less popular once we respond to them. They don't work. We know that from experience in a couple of states that have already tried them. They actually make it difficult for people with health problems to stay healthy and keep working. Most people work, but the paperwork that's involved, the red tape burdens that these compliance requirements impose on employers as well as employees makes it difficult to keep up with reporting requirements and often costs people their coverage, even though they are working. And the bottom line is that cutting Medicaid funding hurts the most vulnerable people. There's 72 million people on the program, and you simply can't, no matter how they dress it up, cuts that they're discussing will inevitably cost people's lives. Next slide. And just a quick recap of who's at risk. Half of Tennessee's children and pregnant moms rely on TennCare, which is, of course, our name for the Medicaid program in Tennessee. Hospitals and nursing homes, particularly in rural areas, are heavily dependent upon Medicaid to stay open. St. Jude's, children's hospitals, heavy reliance on Medicaid. Seniors and people with disabilities, nearly 2/3 of people in nursing homes are reliant on Medicaid. This is a $13 billion program, and it is a huge economic driver, particularly again in rural communities. So cutting Medicaid really will have an adverse effect on entire communities and on employment. And it, of course, exposes, when you cut Medicaid, you expose more Tennessee families to the burden of medical debt. So please help us get the word out to people about what's at stake. And I'll turn it back to Jane at this point. Thank you, Jane.
Next slide, please. Thank you so much, Gordon, for that recap of what's going on at the federal level. And just to bring things back to what's happening here in Tennessee, I wanted to share a story from an anonymous TJC client. If you don't mind, I'll just be reading out from the slide, but I hope that when we share these slides out, you can all read over these words and really think about the reality of the situation that we're about to share. As Gordon mentioned, for pregnant women across the country, Medicaid is often a lifeline. For one TJC client, her difficult pregnancy made it impossible to continue working, so she lost her job and with it, her private health insurance. The sudden loss of both income and coverage added unimaginable stress to an already overwhelming time. Fortunately, as a pregnant woman in Tennessee, she qualified for TennCare, the state's Medicaid program. She was able to quickly enroll, and in that time of uncertainty, TennCare helped her stay afloat. Thanks to TennCare, our client received the care she needed for a safe birth, and when she was unexpectedly admitted to the hospital before her scheduled inducement date, she did not have to hesitate or worry about cost. This meant that she could focus entirely on her health and the baby's well-being. And with 12 months of postpartum coverage, which TennCare also provides, she left the hospital knowing she could continue to care for herself and her newborn without the burden of medical debt. TennCare gave her the freedom to focus on raising a happy baby, and it increased the chance of her baby living beyond its first year of life. In Tennessee, Medicaid covers about 50% of all births. The proposed federal cuts to Medicaid threaten the stability of this essential lifeline, putting mothers and babies across the state at risk. Tennessee already has one of the highest maternal mortality rates in the country, and that rate could rise even further if access to care is reduced. Protecting Medicaid is not just about policy, it's about people. I just want to thank the client who gave us permission to share this story with you all today, and encourage you to share this story and many others that we are compiling on the TJC website about the real people behind the policy. Um, Thank you all for giving us that time. And now we'll be moving over to SNAP. We'll be hearing about the SNAP program today from Signe Anderson, TJC's Senior Director of Nutrition Advocacy. Signe has extensive experience in the anti-hunger policy space, previously being at FRAC in DC. Here at TJC, she oversees our advocacy on the SNAP program, on WIC, TANF, summer EBT, and school meals, really the entire breadth of the public safety net for children. Thank you, Signe, for your time today. Handing it over.
Thanks, Jane. Hi, everybody. Good to be here today. I wanted to just lift up what Gordon said at the beginning. Like, these are crucial weeks to be contacting Congress. This is when to talk to them. This is when they need to hear from you, because they're in that decision mode right now. And I had the fortune, I guess, of meeting with many of our legislators yesterday in DC, and was lifting up some of the stuff that I'm going to share with you now. I think it's really important to share the basics of the program and understand that our Congress folks do not necessarily know the basics of the program. So sometimes explaining the basics is really important, educating them on who participates. And Jane had just ended with some stories. I'm going to share a little bit about the stories that we've had coming in about the importance of SNAP to the families that we serve. And then I also wanted to just leave everybody with some basic understanding of the current threats to SNAP, with an understanding that this is all a little bit fluid, but I think it'll help to just understand what we're asking when we're asking them not to cut SNAP. So you can move to the next slide. All right, so some of these facts that are really important for Congress to understand. In Tennessee, around 760,000 people in Tennessee rely on SNAP, and it's working. It puts food on the table, and we know that it could work a lot better here in Tennessee. So at the federal level, we want to make sure that all of this is protected, so that Tennesseans can continue to access their SNAP benefits. We serve many different households across the state, households with children, veterans. We serve so many people who are working but are underpaid, and even when they're working, they still qualify for SNAP. We work with a lot of older adults, disabled individuals. And so all of these folks would be impacted if Congress decides to cut SNAP. And it's not just about the individual. We care and work deeply with the individual, but these cuts to SNAP would have much deeper impact on the economy, and farmers, and even on our schools. SNAP brings in approximately 1.6 billion to the state, to Tennessee annually. So that's something to keep in mind. And the impact on rural Tennessee is also real. It helps 1 in 6 rural families and 1 in 9 families in smaller towns. And like I have already mentioned, SNAP also has implications. People who are not able to access SNAP, it ends up impacting access to WIC, school meals, and the summer meal programs, summer EBT as well. So we can go to the next slide. And I know we shared a little bit of this last week, but I think this is really important to keep front of mind. Cuts to SNAP will affect families, and it will affect businesses. Like I mentioned in the previous slide, making sure that our legislators know that veterans and older Americans, children, working Tennesseans will be impacted by these cuts. 50% of SNAP households in Tennessee have children, 1 in 6 rural families, and working families struggling to make ends meet. And we can go to the next slide, and I'll share a little more information about the latest threats to SNAP at the federal level. So possible cuts to SNAP. You also heard Gordon talk about the 230 billion cuts to SNAP, and these are some of the areas where they're expecting to uh, make up that cost savings that they're talking about. Um, and one of the areas that they're looking at is creating stricter work requirements for Tennesseans. They're talking about removing the state work requirements completely. Tennessee has not tapped into that over the last several years, but in the past, before the pandemic, we relied heavily on these waivers, and they need to be in place in the event of an economic downturn, and should not be taken away. The place where we have seen some progress over the last year is last year at the same time Congress made changes to waive individuals who are homeless, veterans, even children aging out of foster care. There were provisions made in the last reconciliation to make sure that those individuals were able to be waived of work requirements, and they're talking about peeling that back. So keep your eyes peeled on the work requirements. We don't want stricter work requirements. Just like Gordon mentioned for Medicaid, work requirements don't work. They make it harder for people to find work. If you're hungry, how are you supposed to navigate the process of getting and keeping a job? So that's one area that Congress is looking at. Another area is limiting or reducing benefit amounts. Over the past few years, and during the previous Trump administration, there was a huge effort to look at the benefit amount and whether or not um, families were receiving enough. And so Congress looked at that under the direction of the previous Trump administration and decided that the benefits were not enough. And so that has increased over the last few years, which is a good thing. So right now, families who are participating in SNAP on average, $6 a day is what they have to pay for meals for one day, which is not a lot. And Congress is talking about either reducing that benefit amount or making it stagnant so that there's no future room to keep adjusting that with changes in the economy. We don't want to see that happen because already families struggle with the current benefit amount. The next thing that they've been looking at and talking about is state cost shift, a shift in the state costs. So right now, the federal government pays for SNAP benefits. The state doesn't pay that cost. We get those dollars from the federal government, and there is conversation on the federal level to make states pay for part of the benefit amount. That is something that our state could not afford, and that should remain a federal cost. So that's something to keep an eye on. And also, they've been talking about immigration restrictions already. SNAP serves very few immigrant families. You have to be a refugee or have a certain immigrant status, but there's even conversation about peeling that back as well. So be on the lookout for all of those and any stories that you have related to work requirements or making Congress understand that the benefit is not enough and needs to be preserved and even made better is important. Again, this continues to be fluid. That's why we're having these conversations every week. But this is something to keep on top of mind as you're talking to your legislators this week and next week. And we can go to the next slide. And stories, like I mentioned at the top of this remark, the top of my remarks, stories are really, really important. I had the privilege and honor of participating in a rally yesterday at the Capitol to really energize all of the states that were going to speak to their legislators. And so I was able to lift up stories from Tennessee. And this was one of the stories I shared. And I'm just going to kind of give you an overview of this story and share a couple others. But this is a story from a grandparent in Tiptonville, Tennessee, which is one of the poorest, most rural counties in the state. And this grandmother is raising her 10-year-old grandson unexpectedly and on her own. And SNAP benefits are really vital to their being. And they would literally starve without them, she says. And this is just one of those stories, just to give you a sense of a couple of other stories that have come through that really speak to the meager amount of SNAP benefit that exists. We've had another parent with 4 kids who shared with us that everything is so expensive. It's really hard to feed her family when food prices are so high. The SNAP program really helps them. And another family in Sparta, Tennessee, a parent shared that without SNAP, she wouldn't be able to feed her family after rent and basic bills are paid. She has just $24 left to make ends meet until their next paycheck. And that's just $1 a day for a family to live off of until they get paid again. And so I think lifting up these stories are really, really important. If you have if you have your own story or individuals that you work with that are constituents of your legislators, make sure that they hear them. I think that's one thing that's really, really effective when you're talking to legislators. The other thing that I know Gordon touched on briefly, and we definitely got questions about yesterday when we were meeting with legislators, was the talk about fraud and abuse. I think it's really important to make sure people understand that there is little to no fraud and abuse in the SNAP program. The fraud and abuse that's happening is through skimming. And so Congress needs they need to address that. They need to address the skimming issues where the families are the individuals that are experiencing fraud and abuse when their benefits are stolen. And so what is Congress doing to address that? There needs to be funding set aside so that families are not are no longer victimized by criminals, sometimes from criminals from from abroad that are infiltrating their accounts and taking their SNAP benefits. What is Congress doing about that? Because that's where the real fraud exists. And I think that might be my last slide.
Yeah, thank you so much, Signe. That was a really helpful recap, especially with the story element. We're going to spend just a couple minutes now talking about, again, reiterating that the next few weeks are critical, what you can do, and hopefully give you all the tools to take some of these steps. So if you haven't already done so, it's time to call Senators Blackburn and Haggerty and your member of Congress at the toll-free number. You're giving them this call to let them know that you are paying attention to the proposed cuts to Medicaid and SNAP and that you oppose those cuts. If you've already called them, then call 3 friends and ask them to do it. I think the more people we can get making noise about this, the more effective the advocacy will be. We've heard from Gordon and chatter from DC that the increased advocacy, increased attention to these cuts has already been very effective, and is the reason that there are more delays and more disagreements about how to go ahead with these cuts, because now essentially nobody wants to be seen as hurting the most vulnerable people who need Medicaid and SNAP. So our advocacy is working, and we're just here to push you all to continue to do that and to bring more people into the fight. Also want to make a point that there will be National Days of Action to Defend Medicaid on May 14th. So that is next week, Wednesday, and the week of May 19th. So please, please, please follow TJC on all of our socials as we update you on the most up-to-date information and let you know how you can take action during those weeks and beyond. Next slide, please. We also want to highlight that we have an organization sign-on letter. So this is a statement in support of the Medicaid and SNAP program here in Tennessee, and once again reiterating our opposition to cutting those programs and harming the families that rely on them to survive. So if you can, please scan the QR code on the screen right now and share with your organization, and please become one of the signees, one of the signatories on this letter. We will share this with our representatives in DC and share not only from an individual level, but from a coalition and from an organization level that we stand with Medicaid and SNAP, and we want to maintain the integrity of those programs here in Tennessee. So the QR code is available on the screen right now. If you can take a minute to scan that, and that's with your mobile phone. And it's a very simple process to access access the letter through the QR code. But we will also share a direct link when we send out the slides following today's call. And you can also see in the chat, there's a link to the organizational sign-on letter that you can all access. If you have any issues with that, we will be happy to help you. But we are really hoping to get organization only names added to the list of supporters for this advocacy campaign that we're pushing right now. So yes, please join our fight and add your organization's name. Next slide. So now we can switch to the Q&A portion of our call today. We have a couple of questions that have come in the Q&A box. And we have one question in the chat, and then we'll open it up to everyone. So Gordon and Signy, if I could please have you all turn your cameras on, just so we can have a little bit of a conversation in this portion of the call.
It's a mercy, I'm sure, but my camera has been disabled by the host. So that's a break for the viewers.
Same here.
I'm sure we can get that fixed very quickly. All righty, here we go. Thanks, y'all. So we have the first question, which I think both you and Signy should answer, which is, how can those of us living at multiple intersections and marginalizations prepare for these cuts?
If I can take a first swing at that, I would say that we don't know, in the case of Medicaid, we don't know how the cuts will play out in terms of where they will be most strongly felt. We know there's a lot of hostility towards different communities that are affected by both of these programs. I think that the takeaway I have for that is there needs to be a very simple message at this point, which everybody can say, which is hands off, don't cut the safety net. Doesn't make any difference what community you're in. We need to be saying that message with one voice. If we can keep them from imposing these big cuts in the amendments that they're going to come out with next week, we will have saved ourselves a lot of work downstream. It's likely they're going to still come out with cuts next week, but the more pressure they feel, we've already seen that it's delayed them. They're having difficulty wrangling various groups within the Republican caucus. So we just need to raise a storm of polite but firm messaging that's very simple. Hands off Medicaid, hands off SNAP. That would be my response at this point.
I agree with Gordon. I think that's the best message. And one thing that I would say is, a couple of the visits we had yesterday, they said, well, you've got to agree that we've got to cut somewhere. Cuts have to happen somewhere. And my response to that was not from SNAP, not from Medicaid, not from some of the poorest people in the country. I said, if you want to find cuts, look somewhere else, because the people that we work with, a lot of them have nothing, and you can't cut something from nothing. So no cuts to the people that rely on SNAP and Medicaid.
If I could just add to that, we know that this is all in the service of tax cuts for the hyper rich. But that is not something that you want to say to our congressional delegation, because they interpret that as hostility towards President Trump. They see that as a left-leaning talking point. So that's the reality, but it's not a good message. I think we just say, don't cut these programs. And I would add, again, our task at TJC, because we represent people from all backgrounds across the state, we are always looking for common ground. And one talking point around Medicaid is that President Trump said that promised that Congress won't touch Medicaid. And I would just say that to our members of the delegation: honor President Trump's pledge, don't touch Medicaid.
And I'll also chime in with a response. I think if you or others are at multiple marginalizations and intersections, one thing that is really important is just to keep paying attention. Medicaid is seen as a wonky issue, is seen as something that only a few people really understand, and even if some people might feel that way, the truth is it's an issue in a sector of health policy that affects us all. So whether you're representing yourself or an organization that exists at multiple intersections, you are better served by continuing to pay attention to the issue of Medicaid cuts and just really understanding what is proposed and what that could look like, and not, again, saving yourself the trouble of being surprised in the next couple months by what may or may not come. So I think just information is key. So we've got another question. This one is for Gordon. An anonymous attendee asks, you mentioned something about states that have design authority. Can you expand on what kind of design authority Tennessee has?
Well, there's a saying that if you've seen one Medicaid program, you've seen one Medicaid program, because they vary so much. The way Medicaid works is Congress created 60 years ago, when they established the program, a sort of general framework that includes certain features that are universal, such as coverage for certain groups of children, coverage of certain required services. Every state must cover hospital services, for example, physician services. But then once you get past those sort of basic core requirements, the states have a lot of flexibility. So they can decide, as our state did, not to expand Medicaid to childless adults, working adults that are just above the poverty level. We're one of only 10 states now that don't cover those people. And it's a source, frankly, of heartbreak to those of us at TJC. It's because we know folks who are adversely affected by that, and we know that that costs lives. But our state has chosen not to do that. Most other states have. Other states have chosen to cover additional categories of children that we have not chosen to do. They cover services that we don't do. So there's a lot of ability to mix and match. And then states also define the rates that are paid, how much they're going to pay the managed care companies that ultimately pay the providers. So when we say we don't know yet what the specific cuts will be, it's because if you have a dollar mark, as we do, in this case, 880 billion that they're tasked with cutting for Medicaid, there are multiple ways to skin that cat, and they can choose some methods which will impact one population more than another. But at the scale that we're talking about, no one's going to escape unscathed. And so when we talk about the state having a lot of design authority, it can make those decisions within the budget constraints that are going to be imposed by the federal government. It could be that Congress will, probably for political reasons, reach out and try to explicitly do harm to particular marginalized communities for performative political reasons. But by and large, I think it's expected that they're more likely, because the program is so popular, they're more likely to leave the decisions about who gets cut to somebody else and wash their hands of it.
Thank you for addressing that question, Gordon. Signy, I've got a question for you. Ann Lucas in the chat asks, does SNAP include Meals on Wheels, which I believe is asking if the SNAP funding goes to the Meals on Wheels program.
No, that's not covered under the SNAP program. But so not connected to SNAP dollars.
That's the good news. It won't be affected by SNAP cuts. The bad news is it's already targeted for being eliminated on its
Yeah.
own. So DOGE is going after the Department of Governmental Efficiency is already going after that. Just like it's going after, as I understand it, the food banks, so we're shredding the safety net from multiple directions, and which again makes SNAP particularly crucial.
I've got another question from the Q&A, and I'll read this one out. The budget process for fiscal year 2026 isn't typically done until the September 30th deadline or after. Is the budget we're talking about the delayed 2025 budget?
It is, and they're only allowed to have one budget reconciliation package per fiscal year, and the federal fiscal year starts October 1 and runs through September 30th. And we are already well into, halfway into the federal fiscal year 2025, which started last October. And there was no budget resolution package, so budget reconciliation package. So unfortunately, that means that the Congress, the Republican majority in the Congress, can have two different versions of this process that we're going through now. So this is both a sprint and a marathon, because if they don't get these cuts through now, then they may try to come back and do that in the budget resolution process, budget reconciliation process for the next federal fiscal year that starts October 1 of 2025. So it's a sprint in that key decisions are going to be made between now and Memorial Day, the next 2 weeks. Just to spell out a little bit what goes on beyond that, that's the House version. If the House adheres to that schedule, and if they include cuts, and there's some rumors going around now on the Hill in Washington that maybe the cuts will be somewhat smaller, maybe $600 billion rather than $880 billion. That's a reflection, again, of the great work that folks are doing across the country to say hands off these programs, the fact that they're beginning to pull in their horns a little bit. If, in fact, the House passes the budget package by Memorial Day as intended, then it goes to the Senate. The Senate was going to act on that within June, by mid-June, but we've heard that there may be delays until the 4th of July. Also, again, to go back to the messaging about President Trump and Medicaid, he is very uncomfortable about the polling that shows how popular this program is. And he is advancing the idea, which is being, of course, resisted by the pharmaceutical lobby, that the savings could be achieved by cutting drug prices in Medicare and Medicaid more aggressively, rather than by cutting benefits. So again, I think part of our messaging to our delegation is we like President Trump's solution to this thing. If you're looking for savings in health programs, take it out of big pharma and don't cut people. But this is in flux. And so if we are able to delay this thing and continue to delay it, if we can delay it into the fall, even though they have a chance to have another budget reconciliation package that in which, if they're not successful, they could revisit these cuts. And that's the marathon part of this campaign. Next year is a congressional off-year election, midterm elections. All members of the House and a third of the Senate is up for election next year. Historically, unpopular votes become much more difficult in an election year. And so if we can survive the next 2 weeks, if we can delay past that, if we can just keep slowing things down until the public understands what's at stake, then it becomes very difficult for them to do this effectively next year. It gets harder for them. So yes, there could be another round in this fight. There may well be one, but we are at a much greater advantage as we get closer to the midterms.
I've got one question in the chat that's maybe more of an idea than something either of you could speak to, but I'll go ahead and read it out anyway. Has Tennessee Congress or MLGW considered taxing Elon Musk for his business endeavors in Riverside subdivision that could equal the cuts they want to make?
That's above my pay grade.
I figured, but at least we're getting creative. So thank
Right.
you, Adriana, for the insight.
And again, when I think when we're talking to our friends and our social groups, I think making the point about who these cuts benefit and who they disadvantage is really important. When communicating to Trump supporters, when communicating to our congressional delegation, that is not helpful because that's decoded as you're on the other side, you're on the other team, and I'm not going to listen to you. So, you know, Elon Musk is popular in some quarters, and we try to find the place where the most people can find agreement, even if they don't agree on a lot of other things. And I think most people agree on President Trump's proposal to take the money out of drug prices rather than out of Medicaid, for example. And that's where I would lean.
Yes, thank you. And we're hearing chatter, and Sydney, I'll turn this to you, but Gordon, I have a very similar question for you. We're hearing chatter, and you both touched on this a little bit, that one of the ways that these programs would absorb the cuts is by having increased administrative burdens. So that means things would be more or less harder for the people applying for the programs, people who want to stay on the program. Can you talk about what an administrative burden would do to a family on SNAP? Can you talk about what that could cover, what parts of the SNAP process administrative burdens would affect, and what an example of an impact could look like for a SNAP?
Yeah, I mean, already it's started, right? They have already been cutting staff at the federal level, and I think maybe that's trickled down to some state level positions as well. But when you don't have staff in place to process what needs to be processed as far as applications and approvals and making sure that things are caught or move forward, that slows down people from getting benefits or prevents them completely from getting benefits. So that's one way that I think is already moving through the works.
And Jane, we have a lot of experience at TJC, real world experience with this. We're involved in a lawsuit against the Department of Human Services right now over SNAP. And if you want to know what the effect is of red tape and administrative burden, you only have to look at the data from that lawsuit and another lawsuit that we're involved in about TennCare, because last year they reduced the enrollment in SNAP by 100,000 people without ever changing the eligibility rules. They just made it so difficult for people to have the required interview, to navigate a computer system that was unreliable, to submit duplicate copies of documentation of their employment records, only to have them lost. I mean, you can wear people out pretty effectively. If anybody has ever had to sit on hold and listen to a recording over and over again to get through to a complaint department, you don't need any further description of why that sort of thing can cost people their coverage. Last year, DHS was taking, people were on hold for up to 45 minutes or an hour, in some cases 3 hours, only to be cut off. So we know that you can dial the red tape up or down. You can dial the administrative burden up or down. We've seen the same thing in TennCare. Last year, over about an 18-month period, 300,000 people lost their coverage in the state, and 75% lost their TennCare, not because they were found to be ineligible, but because of their inability to complete the redetermination process for recertification. So that's a huge issue. And the current favorite, because it polls well, because people are not really focused on this administrative burden issue, is work requirements. Everybody says, well, yeah, what can it, if you're able-bodied, why shouldn't you work? And the answer is twofold. A, most people who are poor desperately want to work. They desperately need to work. And they are working sometimes 2 and 3 jobs, which is, I think, a scandal that in this country you can work 2 or 3 jobs and still not have enough to feed your family, and certainly not enough to pay for basic health care without the assistance of these programs. But as a friend pointed out, well, these people that talk work requirements must not have kids, at least not kids for whom they have to pay for childcare, or they would know that the kinds of low-wage jobs that folks who are eligible for these programs fill don't pay enough to pay for childcare. And of course, DOGE is also cutting back on childcare subsidies. I think it's important to understand that this is all occurring in a context in which there are multiple assaults on the poor from every direction. And so, for example, the client story that Jane told of the grandmother who's in her late 50s and recently became disabled, if she has to apply for Social Security disability, it's likely she'll have to wait for 2 years to be processed. And that was before they started cutting the bejabbers out of Social Security staffs. And people who are not in that world don't realize it's not, you just don't snap your fingers and say, well, I'm not able to work now, so can I still get benefits even though I don't have a certification of my disability? It takes 2 years to get that certification for many people, and it's likely to take much longer. And in the meantime, if they pass or strengthen work requirements, those folks and their households will go without the help that they need. So, if you put together the cuts into the food banks, the cuts to school meals, the cuts with SNAP, you see the cumulative effect of all of this in the compounding effect. We've got to stop these cuts.
Thank you, Gordon, and thank you, Signe. We don't have any other questions, though. If I see one pop, oh, wait, we might have one on the Q&A. Okay, so we can try to address this one quickly. I'll read this out from an anonymous attendee. If federal cuts are made and if states are given total authority to decide how remaining Medicaid and SNAP funds are spent, is it of any value to begin thinking about how to fairly distribute what's left and create a plan designed to educate Tennessee legislators as to possible ways to proceed?
I don't think so. And I say that pretty strongly because there is no fair way to tell one person they won't be able to get the prescription drugs they need, but maybe somebody else will. This is our approach here must be, this is unacceptable. People's lives are at stake. We need to hold hands and stand together, not leave anybody out of the circle, and together insist that this country can do better than that. Our state can do better than that. We are better than that. We care for our neighbors, and that means ensuring that there's enough to protect everybody who needs healthcare, who needs adequate nutrition for themselves or their children, and not be played off against each other. There's no way fairly to do it. I mean, I understand the sentiment of the question, but I've been through this many times before, and there's no way to make that work.
Very well said, Gordon. Sydney, do you have anything to add?
No, I'll just agree to what Gordon said. I think he's spot on.
Great. Next slide, please. So we're right at closing, and I just wanted to take the last 2 minutes to thank everyone for joining us today and give our hosts an opportunity to share their one big takeaway. If everyone on this call logs off, what's the one thing you want them to remember from everything that you've shared today?
Hang in there with us. We can win. We won 8 years ago. We are part of a cloud of witnesses across the country, but we can't let up. The next 2 weeks are really intense. There may be a marathon beyond that, but there's definitely a sprint in the next 2 weeks. And we're going to be, by the way, holding these briefings every Wednesday. And so please stay in touch. There will be a day of action next Wednesday, so we'll be getting out word before then on how you can participate. Thank you so much.
Yeah, and I would say be persistent. And if you need any help from us, we're happy to help facilitate and get you connected to anybody you need to talk to as far as legislators and senators are concerned.
Yeah, and I'll chime in. I think it's really important that we continue to highlight the real people behind the policies. So we've shared a couple times in the chat how to share your story. If you've been affected by Medicaid or if you know someone who has, please let us know. Every time we uplift these, it does make an impact. It does resonate with people. So I really want to leave everyone with an understanding that this is a people first advocacy campaign, and it's something that we will continue to highlight is the real people, the real Tennesseans who are affected by everything that we've discussed today. And with that, we're right at closing. In this slide, please, you have our contact information for the 3 speakers, as well as TJC's socials, which is also in the chat. So don't hesitate to reach out to us. We would love to hear from you and love to hear how your advocacy is going. Please stay engaged, and thank you so much for being here with us today.